Hi, I'm Dr. Matilde from Cellular Institute. When considering stem cell therapy, safety should be one of the most important factors when selecting a clinic. Today, I want to take you behind the scenes and show you the final steps we follow before any cellular product is administered to a patient. After the cells are processed and tested in our laboratory, the product is transferred to our dedicated reconstitution and quality control area. Here, our medical team performs a final series of verification, preparation, and safety procedures before the cells are used for an injection or infusion. Today, we will review the intravenous stem cell administration protocol, from patient selection through post-infusion monitoring. It's important to understand that we are working with highly active biological products. Pre-medication should be from 30 to 60 minutes before the infusion. We recommend the use of diphenhydramine 25 to 50 milligrams venous access preparation. Before preparing the cellular product, confirm functional peripheral IV line, verify adequate venous return, confirm patency with normal saline, and ensure proper stabilization of the catheter. The cellular product should not be prepared until functional and reliable venous access has been established. Product preparation. Now, we will show you how the stem cells are thawed and prepared for administration. At this stage, the required cell dose of the patient is confirmed according to the treatment plan. The next step is to retrieve the appropriate vials from the ultra-low temperature freezer. Once the correct vials have been identified, they are placed into the transfer container to prevent unnecessary exposure and minimize the risk of cross-contamination during transportation. The transfer container is brought into the laboratory processing area. Inside the laboratory, the transfer container is opened and the cell vials are transferred to the water bath. The vials are placed in a water bath maintained at 37 degrees Celsius for approximately 2 minutes. Once the timer sounds, verify that the product has reached a fully thawed liquid state. Following thawing, the exterior of each vial is disinfected with alcohol before being transferred into a biological safety cabinet. Inside the biological safety cabinet, the vials are further disinfected with microdiazine. The vials are then opened and their contents transferred into appropriate processing tube. The next step is viability assessment. Once the viability analysis is completed and results have been verified, the product is prepared according to the prescribed presentation. Depending on the treatment plan, the cells might be prepared either in a syringe for direct administration or in an infusion solution for intravenous delivery. The final volume and concentration are adjusted accordingly to the total number of cells required for the patient. Once the preparation is completed, the final syringe or infusion container is disinfected externally with microdiazine and the product is released and delivered to the clinical team for patient administration. The suggested dose is a 0.5 million cells per kilogram of body weight. Infusion administration. The infusion should be administered using an infusion pump over approximately 45 minutes. It's strongly recommended to use a whiteboard connection with a 500 ml bag of normal saline solution available through the infusion. Before initiating the infusion, confirm venous patency, reassess vital signs, confirm clinical stability, and throughout the infusion, maintain continuous clinical observation, monitor blood pressure, heart rate, oxygen saturation, and overall patient status. General management during the infusion. If any clinical event occurs during the infusion, temporarily stop the stem cell infusion, close the stem cell line, continue with normal saline through the whiteboard, reassess the patient, and monitor vital signs. In most situations, these measures are sufficient for symptom resolution. Transient inflammatory response. Due to the interaction between the infused cells and the immune system, some patients may experience transient inflammatory response associated with cytokine release. This response may begin approximately 5 minutes after starting the infusion and typically resolve spontaneously within 10 to 15 minutes. Common manifestations include headache, frontal pressure, dizziness, palpitations, chills, low-grade fever sensation, and transient hypotension. Someone can experience general malaise, and it's important to recognize that these manifestations are generally self-limited and transient. For the management of fever and chills, you must know that some patients develop fever shortly after infusion. So if a significant temperature elevation occurs, you can temporarily pause the stem cell infusion if you continue with it, and continue with a normal saline infusion. Administer intravenous acetaminophen as clinically indicated and maintain an adequate hydratation. Continue with clinical monitoring. Avoid excessive warming with heavy blankets or external heat sources. For the management of the transient hypotension, if you have a patient that developed hypotension, you have to temporarily stop the stem cell infusion and continue with a normal saline infusion. If needed, place the patient in a Crandall-Lambert position. You can apply a warming blanket if needed and administer additional 500 ml of normal saline. You can initiate supplemental oxygen via nasal cannula at 3 liters per minute and titrate the oxygen as clinical indicated. Continue with close monitoring of vital signs. This can determine the outcome of your patient. Most episodes are transient and respond very well to supporting measures. Post-infusion monitoring. After completion of the infusion and saline flush, obtain blood pressure, heart rate, oxygen saturation, temperature, assess symptoms, and confirm hemodynamic stability. Before discharge, patients should be informed that they might experience fatigue, headache, frontal pressure sensation, dizziness, palpitations, and chills. Also, they can experience fever-like symptoms, muscle aches, and general malaise. These symptoms generally represent the expected biological response to treatment and typically resolve spontaneously. All observations and events occurring during the infusion should be documented on the patient's medical record. The key to safe intravenous stem cell administration is proper patient selection, close clinical monitoring, and early recognition of the expected transient inflammatory responses.